Hello, it's Amy Olson here at Lakewood, and I wanted to talk to you today about some continuing education that Carolyn, one of our technicians, and myself have done recently. Every year the state requires licensed veterinary technicians and licensed doctors, veterinarians, to complete a certain number of required courses to stay abreast of the newest, treatments and diagnostics and everything in our field. So Carolyn and I had actually already completed our necessary coursework back in May. And when most of the staff actually went to the CVC in DC, in Washington, D.C., where we all took classes for a few days. But her and I really enjoy that sort of thing, and so we decided to take off to Kansas City and go to the CVC, which is the Conference for Veterinary Care. And this one was in Kansas City. So we took off a couple weeks ago, very late Friday night, and we got home very, very, very late Sunday night, so we were kind of tired Monday morning, but we went down to Kansas City for all-day lectures on Saturday and Sunday. In fact, at least Sunday we even did lectures during lunch, so literally packed day of 8 or more lecture hours each day. And it was really good for both of us. The whole plane ride back, Carolyn was going over all the things she had learned, different emergency techniques, nutrition. She just went to a lot of different interesting lectures and learned a lot that she's already started to incorporate here. I learned a lot as well. I attended a few lectures on feline asthma, urinary tract disease in dogs, Lyme disease, Ehrlichia, anaplasma, and other tick-borne diseases. I went to a really great lecture on zoonotic diseases, which is a term. Zoonosis or zoonotic means people can get it too. So infections and things that people and animals can share or go back and forth or what have you. So, but anyways, lots of great stuff that will help our patients and also, of course, their owners. And I just always love to go to these conferences because, it's just invigorating to have all these people around, whether it's salespeople or people from drug companies, people from the government, veterinarians, veterinary technicians, lay staff, meaning office managers and receptionists, people like that. But everybody's there for one common goal. No matter what species you work on, you're just there to improve animal health. And there's a whole lot of veterinarians that are actually dedicated to just improving human health by knowing about things that affect animals. People in food safety, USDA has a lot of veterinarians on staff, things like that. So it's just really awesome to be around that kind of energy, just where everybody's so excited about the profession and about doing good in the animal population, which spills over into the human population. So anyways, like I said, even though we had our stuff done in May, I think I might make this a bi-yearly trip for me because it was just really great. So a couple of the things that we brought back to use, Carolyn really was excited about this warming system. We have 3 different warming blankets that we use for our patients under anesthesia or patients that come in hypothermic from a variety of different problems that they have. And it's warm water circulating through a blanket, and that keeps them warm. This works by a little different technology, and you kind of wrap the patient in it. And anyways, our goal was just to find a new method of keeping these guys warm so that we have a couple different ways of doing that. Sometimes it's not always feasible to have one certain thing working, or if something breaks down, we just wanted to kind of have a couple different options. So we're really excited about that. My cool toy that I bought at the CVC, which I'm really excited about. The staff here thinks that I look like an idiot, but I don't care. I think it's awesome. And it is my new headlamp. Fancy. So when I'm working on things in surgery, all I have to do is look at my fingers, and then the lamp kind of shines down right where I'm working. So if I'm working over here, I just look at it. So previously what I had to do is, if I was looking into, say, a mouth, doing a dental cleaning, and maybe I was trying to look at a lesion or extract a tooth, and it was maybe being a little tricky. It's hard because the mouth is very, very dark. It's a big hole, essentially a big cavity. So we have a really nice overhead light, but trying to angle it in there and everything can be tricky. And then if you move the mouth a little bit, the light's off. So what's great about this is I can use my hands for what I need them for in the mouth, whether it's just inspecting things or actually working and removing something or stitching something. But anywhere I look, you know, this cool light is on there. So I'm really excited to use it for body cavities. You know, you can wear it in the OR, and so if I'm looking into a body cavity and there's something bleeding, you know, again, it's a big open cavity and it's very dark in there. And even though we have high-powered surgery lights above the table, sometimes just angling them just right can be tricky. And I'm expecting that this is going to really help being able to see in, you know, around little corners in the back of the spleen or way down by the aorta when we're removing, you know, bleeding tissues and stuff like that. So I'm very, very excited about my new goggles, and I don't even care how bad they look. So anyways, just wanted to kind of share with you some of the cool things that we're doing here to, you know, try to keep our patients safe and stay abreast of the you know, latest and greatest. By the time information reaches these big fat books that I have here on my shelf, it's kind of old news. And while old news is still important, what's great about these conferences is a lot of times they're talking about, you know, hey, this study was just completed and it's getting published, or it was just published, or, you know, maybe we're not going to publish this information, but look what this shows. And I like doing that. I think that's, you know, that's really exciting to be on that kind of cutting edge of stuff. And I think, you know, it's also great to be around the other veterinarians there. I'm a solo practitioner here, so it's really neat to be in a room full of, you know, 30 or 100 people. And at the end of the session, you know, they have a question and answer almost always. And so other vets often will ask the same questions that I've had. And you kind of go, okay, you know, everybody deals with these problems or these questions, and here's how a specialist would answer that. So I actually had 2 or 3 patients in mind specifically when I went to the conference, and was able to kind of get some really good information for those patients and those owners there. And so anyways, really fun, really exciting. And if anybody did want to see me that afternoon, I don't think we got too many calls that afternoon when I was out trying to catch the plane, but we appreciate your patience. Ultimately, we're doing it for you guys long term. So if you have any questions, let us know. But otherwise, thanks for watching, and we'll see you around Lakewood. Bye.